Hi everyone, it's Sara Northrup at Texas Panhandle Centers for Behavioral and Developmental Health. I'm so pleased to have a conversation with Cindy Peters, who is the director of our program for those folks that have an autism diagnosis. And April is Autism Awareness Month. So, Cindy, welcome and thanks so much for meeting with us today.
Thank you for having me.
Tell us a little bit about autism. There's so much information that people don't know.
Mm-hmm.
So tell us a little bit about how folks get a diagnosis.
Okay. So basically what takes place at Texas Panhandle Centers is if there are certain behaviors the child is exhibiting, and especially in communication, nonverbal behaviors where they're not making eye contact and they're not talking, some developmental milestones that are not being met.
Okay.
The best thing to do is call Texas Panhandle Centers, go through the intake process. They'll do a testing, and then at that point they're referred to me, and then we look at an assessment, determine what we need to do from there.
Okay. And what's the intake number that people might call if they had questions or wanted to access services?
Okay. The number you need to call is 351-3212. That's Alicia Huckabee. She's our intake person, does a great job of testing. She can test the little ones as well as the older ones. So she has all forms of testings and plenty of room to do it.
Okay, excellent. So what age group do you work with?
Actually, our youngest client has been 2, and the oldest individual was probably 51.
Okay, great.
Mm-hmm.
So what are some of the behaviors that people might exhibit that may be having some difficulty that would lead you all to a diagnosis of autism?
Mm-hmm. I think the most pervasive diagnostic indicator is that there is little or no eye contact, little or no communication. And what the American Psychiatric Association did is they placed pervasive diagnostic disorders and Asperger's disorder and 2 other categories under the umbrella of autism spectrum disorder. And so what that takes care of is many different levels of supports that they need or behaviors that they might have.
Okay. And so when you do bring a person into services, what types of services are people getting when they come into the program?
Okay. So basically what happens is I get a little referral and says, hey, we need you to assess this individual to determine if they can benefit from your program. And at that point I make contact with the parent and the individual, and they're both in the assessment, and then we go through a whole series of questions to determine if they will benefit from our program. If they do, then I contact their service coordinator. Their service coordinator has a meeting with all of us, and we put them on our plan, so to speak. Typically, they have a desired outcome. For example, said individual wants to stay calm, or said individual wants to communicate. Whatever that is what we go with, because we want ultimately for that individual to be successful.
And so that's person directed, and really about what the family members or the adults want it to happen that's different in their lives.
Right.
So it sounds like a wraparound type situation, bringing all those individuals into care.
Yes, absolutely. Yes.
Okay. And so if I'm a parent that my child is having some struggles, are there some support services for me?
Absolutely. First of all, and we feel like this is very important, that the individual who deals with someone that really needs what we call severe supports, they need some substantial support, then we want them to know that they're not alone in this, that there are people, we're there, that there are societies, there's an organization. The Society of America is one of the best ones. They provide all kinds of tools. They actually have a toolkit that you can purchase, which is 100 days on a calendar of what you can do with this individual.
Wow.
I mean, it's really great.
Good.
Then you have the Autism Society of Texas, you have Autism Speaks, that's an organization in Amarillo, and then you have the National Autism Society as well. So you have several pieces of the puzzle that you can get a lot of assistance from.
And I think as a parent, people would probably just want to know that they're not by themselves, and clearly if there's organizations that do provide support, that can just make a big difference, not just while the person's in treatment, but also when we're at home and out in the community doing things, right?
Absolutely, absolutely. I can remember, one of the things we like to do is talk about our success, because the individuals that we have, sometimes the guardian or parent comes to us and they are fairly hopeless and helpless. And so we start working with that individual and we work diligently and we see progress. And then it's so cool to watch them get a job. Absolutely. Or anything like that. And then the parent come back to us later and say, thank you so much, because now my child can be successful.
Well, and really we're just trying to get people to a quality of life that makes sense for them.
Absolutely. Whatever that looks like. Absolutely.
So you are a trained licensed professional counselor.
I am.
And so what is it about this type of work with the population that really is a benefit for you?
Mm-hmm. The individuals who typically are diagnosed with an autism disorder typically suffer from anxiety and depression. They even can have seizures and GI issues, all kinds of things. And so being able to utilize that training, that background, and as a licensed professional counselor, I can pick up on those few cues and symptoms and actually either refer them to somebody who can help them or help them myself.
And really it is about the whole person, isn't it? It's not just, we're not dealing just with one part. It's whole health.
Right.
And so I think that's just so important.
Yes.
In all the programs at our agency.
Mm-hmm. Absolutely, yes. And that's what I like about Texas Panhandle Centers is we are a working team. When we get together, we have nurses, and then we have the service coordinators, and then we have the autism department, and we have all of us together working for the benefit and on behalf of that individual.
Well, Cindy, thank you so much for your time, and we want to celebrate Autism Awareness Month, so thank you so much for your time.
You're welcome. Appreciate it.
As always, our crisis hotline number is 806-359-6699, or if you need any information about autism and our services that we have in that program, 806-358-1681.